My two questions. First one, you didn't tell us about capsule after radiotherapy.
Yes.
Is it more thicker?
No,
After radiotherapy with flora expanders.
All patients, when you put an expander, if they're going to receive radiotherapy, the tissue is going to behave, creating more thickness of the tissue. But compared to other devices, the capsule is thinner compared to other expanders. Why? Because, like I told before,
After radiotherapy
also because there is always inflammation. Radiotherapy creates inflammation. But if we compare to other devices, Flora capsules are thinner. So it's a good expander in cases of radiotherapy because it's the ones that create thinner capsules. But every time, depending on the dose that you receive of radiotherapy, that's a possibility that can happen.
And another question. Sometimes you show us that usually you didn't make a capsulectomy.
Yes, exactly.
Sometimes you make
The second
capsulectomy
stage.
in the second stage. But sometimes if you have so thin capsule,
Yeah.
we need a capsule to reconstruct our submammary fold.
Exactly.
And if that capsule so thin, can it hold all
Yes.
what you need?
In cases that I want to go to a big implant, I try to wait more time to have more stability of the capsule. So I try to stay, instead of 3 months, I prefer to wait maybe 5 months to do the second stage. But what I try to do is I try to encourage the patients to try to go to smaller volumes to have better stable results. Because if we go too much bigger volumes, in the long-term follow-up, the possibility of complications, they are higher.
So usually you make some breast reduction in another side.
Exactly. If it's possible, yes, to have stability.
Yes? Okay, thank you very much. Your lecture was
Thank you.
very interesting. Yes, thank